Hello, everybody. Our guest today is Dr. Sarah Vadeboncoeur from the Docere Naturopathic Clinic on Preston Street here, just right here in Ottawa. A naturopathic practitioner specializing in women's health. Thank you very much for joining me today.
You're welcome.
So my first question for you is, why is there a real need for a naturopathic doctor in our population to specialize in women's health?
Mm-hmm. Well, a lot of women are suffering and are not enjoying the level of health that they like to. So a lot of women have symptoms that they're concerned about. So things like fatigue or low energy, sleep issues, hair loss, weight gain. And these issues are not always being dealt with by their primary practitioner in a way that they're happy with. So a lot of women are just looking for more answers, and they're looking for a different approach to their health that may or may not involve medication, but also looking at things like lifestyle and diet and how these things can really help them to feel better.
Mm-hmm. Well, in my experience, naturopathic medicine actually kind of tries to focus more on the underlying causes of health conditions, whereas school medicine oftentimes just looks for symptoms and trying to kind of deal with them specifically by using drugs. So what are the most common conditions you're dealing with in your practice?
In my practice, I'm seeing a lot of thyroid conditions. So a lot of women are seeking me out specifically because they have concerns about their thyroid. But even if they don't have a diagnosis yet, a lot of women have low energy. They're feeling tired all the time. They might not be having good sleep. A lot of women have weight gain that they, can't figure out how to manage. Hair loss.
Despite many diets, nothing changes.
Absolutely. Yeah.
So when it comes to thyroid, let's look at this a bit more closely. What actually causes thyroid problems?
Mm-hmm. So there's two types of thyroid disorders. The most common one are autoimmune conditions. So things like Hashimoto's and Graves' disease. And basically what happens with an autoimmune condition is that something triggers the immune system, which makes it go kind of wonky. And then the immune system starts to attack the thyroid. So people will start to have thyroid problems. The second type of thyroid disorder is non-autoimmune, meaning the immune system is not involved, and that will often be caused by nutritional deficiencies. So if the thyroid is not getting the nutrients it needs to make hormones and to do its job, that obviously causes a problem. But a lot of what I see is more relating to what's going on in the rest of the body. And so, for example, if people have a cortisol imbalance, so if their stress levels are not being well managed, if they have a lot of inflammation in their system from a chronic disease or from their diet, a lot of those things will actually affect the thyroid as well. So those are some of the things that we want to look at. And then the other piece that we look at are toxins and toxicities. So looking at how toxins in the environment affect our body. And the thyroid is very sensitive to toxins. So even though most of us may not have overt toxic exposures, just the fact that we live in the modern world means we're all exposed, unfortunately. And some of us, can have symptoms of that.
When it comes to nutritional things, people know that the thyroid requires iodine to actually build levothyroxine, T4, and liothyronine, T3. As the name implies, T4 needs 4 iodine ions, and T3 just 3. So if you live in a low iodine environment, then that can be an issue. Iron is an issue, zinc.
And a lot of these toxins actually block iodine. So that's what the problem is. So when we look at things like plastics and mercury and fluoride, a lot of these things actually block the body's ability to use iodine, and so that's where some of these problems can happen. But most of us are low iodine because, as I say, the North American diet is not rich in seaweeds and seafood. So, unless you're eating, lots of, iodized salt, which most people are trying to stay away from, most of us are not necessarily getting enough iodine in our diet in North America. If we compare kind of our intake to Japanese people, for example, we're getting a fraction of what they get through their diet.
And that's pretty easy to supplement as well. Right?
It's very easy, yeah. So I often recommend even something as simple as toasted seaweed snacks that people can add, a few times a week, or eating more fish and seafood are great ways to get some iodine.
So as a naturopathic doctor, you are able to order tests to determine all kinds of parameters in the bodies, in the individual's metabolism. What kind of testing do you usually perform?
So a lot of people seek me out specifically for testing, and a lot of times the first kind of thing I'll do is a complete thyroid panel. And so there's 3 tests in there that are really important. The first one is TSH, which is a test that most people are maybe familiar with or have had run through their doctor. TSH stands for thyroid stimulating hormone. And what most people don't realize is that TSH is not made by the thyroid, it's made in the pituitary gland, which sits in your brain. So when we're looking at TSH, we're really looking at a very indirect way to see what's happening with the thyroid. And in my experience, looking at TSH alone is not helpful, because a lot of women have a completely normal TSH, but when you dig a little bit deeper and you start to look at T4 and T3, you find problems.
That is very interesting, because many physicians just look for that. And unless you're truly out of reference range with this value, they don't get active in any way. But by looking at all parameters affecting the thyroid, you can detect trends and then maybe compare that to the symptoms you're experiencing with, and then become a bit more proactive in supporting you the right way.
So 2 of the other tests which I'll mention are T4 and T3. So T4 is my favorite test for seeing what the thyroid is actually doing, because T4 is actually made in your thyroid. So if you want to see how your thyroid is producing hormone, T4 is the best way to look at that.
In comparison to the TSH.
Right. The limitation with T4, though, is that it's mostly an inactive hormone. So you can have lots of T4 floating around in your system, but if your body is not turning it into T3, then you can still have symptoms. So T3 to me is the most important thyroid hormone, because that's the active one. That's the one that gives you energy. That's the one that helps you maintain your weight, keep hair on your head, keep your mood good. So if you're It's true, but so many women have anxiety and depression, which is actually not truly anxiety and depression. It can actually just be a hormone imbalance.
That's interesting.
So those are 3 of the key hormones that I always look at. There are a few additional tests that I'll also include, but those are 3 of the foundational tests that you really want to look at if you're having symptoms.
So in essence, that means you could have normal TSH and somewhat normal T4 levels in your blood. But if your body is not able to convert the T4 into T3, you will show all signs of hypothyroidism, which is low thyroid function, even though doctors would test and potentially retest these 2 initial markers and not find anything. And then you get this quite common recommendation to go home, you're fine.
Right.
But you're not.
Absolutely. That's actually the most common pattern that I see in my testing, is that TSH and T4 are actually okay, but T3 is the problem. And by only testing TSH, you'll completely miss those cases.
So I believe that you probably also get a lot of clients that are already using Synthroid, L-Troxin as the 2 most common prescriptions for hypothyroidism. Both these medications actually are practically synthetically bioidentical made T4. But if the underlying issue is a problem with converting T4 to T3, then more T4 wouldn't necessarily help you much. No? So a very common complaint is that people, even though they use certain levels of T4 in their daily regimes, they don't feel much better. No? So what does the body need to make this conversion more or better?
Yeah, it's a really common problem, and a lot of women and men come in on Synthroid, and they say, my doctor says my levels look good, but I don't feel good. And often that's because they are not converting well into T3. And the thing that I always explain is that in order for your body to take T4 and make T3, there's all types of conditions that need to be present. You need to have certain nutrients, so things like selenium and iron and zinc. What's the number 1 deficiency that women have? Iron. So right off the bat, most women are at a deficit in terms of being able to use their Synthroid or L-Troxin properly. Then we look at stress. Most people have high levels of stress. Stress can also reduce that conversion.
Does anybody not know what stress is? We could explain here, but I think it's pretty much omnipresent.
Absolutely. We're all under immense stress. Inflammation is another thing that I've actually been testing a lot more lately.
How do you test for inflammation?
There's a simple $3 blood test called CRP, which stands for C-reactive protein. And this is a great little test to see the level of inflammation in your system. It won't tell you where the inflammation is coming from, but it can give you a sense of whether that's a factor in terms of what's going on. And inflammation is now being linked to every single chronic disease, depression, weight gain, etc. So that's why a lot of people can't use those medications effectively, because they have one or more of these kind of things that is not in place that is blocking that conversion. So it's very, very common.
So I know from my old pharmacy school learnings that the actual enzyme that does the conversion from T4 to T3 requires iron as a cofactor to be activated. So if you're dealing with low ferritin levels, low iron levels in your system, and you might be barely able to maintain hemoglobin, which is one of the main functions of iron in our system, you might not be able to perform conversion of T4 to T3 sufficiently enough. So what kind of ferritin levels should we be aiming for, and what are the actual ranges that we're seeing?
So in my patients, I tell them that 50 is the minimum that we're aiming for, and that's the number that's been shown to help in terms of energy. So if their main kind of concern is fatigue, I want to see their ferritin above 50. If we're dealing with any type of thyroid concern, I want them ideally above 70, because that seems to be the number that's needed for most people to have the best conversion from T4 to T3. I can tell you, yes, go ahead.
Well, and just to point that out, the actual reference range varies depending on lab and region, but in general, regular reference ranges for ferritin tend to be between 11 and 300, 320. And normally when we look at lab results, we always aim for mid-range as kind of the optimum place to be in. And in the case of ferritin, that would be at a level of 150 nanograms per mil. And that for many women is very, very hard to achieve due to the regular monthly loss of blood during menstruation. But I mean, that doesn't mean we shouldn't be aiming for levels like that to allow for all metabolic functions in the body to happen properly, not just the ones with highest priority, like maintaining hemoglobin levels in the blood.
But yeah, just to put that in context, most of the women I see in my practice, their ferritins are usually somewhere between 10 and 30. So even just bumping them up to like 50 to 70 for most women makes a huge difference. I would love to see them at 150, but that usually doesn't happen until after menopause.
That might be wishful thinking.
Yes. But yeah, iron deficiency is very, very common. And a lot of times, I love when I find an iron deficiency, because I'm like, I know why you're so tired, and this is super easy to fix with a good quality iron supplement. So, I would encourage you to know your numbers, because going back to, everything being told they're normal, a lot of women I ask, have you had your iron levels checked? Oh yeah, I was told it's normal. And I always say, I'll believe that when I see it. And I always request a copy.
That's good.
And often they're way below that 30 or 50 range.
I think that in my experience as a pharmacist, I find that compliance is the biggest problem with iron supplementation. Side effects are a huge issue. Iron can cause gastrointestinal pain and discomfort. And if you're using a lesser absorbed kind of iron, you can experience significant problems with constipation long term. And that kind of makes people at some point drop off the actual supplementation. I also believe that many women, once they experience this initial improvement in energy, they tend to forget to continue to use iron supplement in the overall goal to reach specific ferritin levels as a target. Because, I'm feeling so much better, I have the energy I thought I needed, so I don't need to use iron supplements anymore, which means you're very likely to very quickly drop down again. You've got to rebuild your iron stores, which is measured by ferritin. Ferritin is actually our binding protein for iron in our system. So we got to kind of educate people, especially women, to aim for a certain ferritin goal and get there. and not stop supplementation too early. So dropping off too early is not good because it means you're kind of dropping back into the same condition and the same problems pretty quick. So if you're kind of providing all these beneficial effects and looking at the key factors and issues in the individual, I believe that once you manage to generate more T4, T3 and T3 conversion, your overall metabolism actually gets accelerated, which means your requirements for specific nutrients is going up, and potentially also your requirements for more food.
Absolutely.
No? But you're actually requiring, or you're developing more appetite because you're actually also physically burning more energy, so you got to feed and fuel the system. But what kind of key nutrients are you looking at in this phase of reestablishing proper thyroid balance?
So before we jump into the nutrients, I'll just comment that a lot of people that initially when they take thyroid hormone feel good, but then they start to feel worse. And I think part of that is that if your nutrient levels are already low, and now you put your foot on the gas pedal and rev up your metabolism, your small amount of nutrients that you have in your system is going to get burned through much more quickly. And I also see a big connection with if there's any type of adrenal dysfunction or cortisol imbalance, and then you start revving up the thyroid, the adrenal symptoms will often worsen because you're speeding everything up, and again, you don't have that kind of metabolic reserve to back that up. In terms of nutrients, I really love bioactive B vitamins. I suggest a lot of foods that are rich in zinc and selenium, so something as simple as adding a small handful of raw nuts and seeds. I especially love pumpkin seeds and Brazil nuts for their zinc and selenium content, but also just eating more real good food. And it sounds silly to say that, but most people are not eating enough whole foods. So even just adding lots of different colored, brightly colored fruits and vegetables, making sure having enough good quality protein, enough fats, which a lot of women are still, scared of. Because as you say, when you rev up the thyroid, you rev up the metabolism. And so you need to make sure that you have fuel to feed that metabolism.
And today, I believe we're looking at fuel more on the fat side rather than the carbohydrate side.
Right.
I think any active reduction in carbohydrate intake is beneficial. Sugars or carbs actually promote inflammation, whereas fats, especially the good fats, kind of tend to reduce your overall tendency to promote inflammation. So you don't have to become a brand new person tomorrow, but I always say that make conscious decisions on reducing one over the other, and you'll be on the right path.
Yeah, I'll just balance that by saying that you do want to be careful with too few carbs actually with the thyroid. As soon as the thyroid starts to feel any type of starvation or severe restriction, it slows down. Because if it feels like food is not coming in at a regular kind of pace, what it does to protect itself is it slows down your metabolism so that you can survive. So it's a fine balance, and certainly most of us are eating way too many carbohydrates. But because diets like keto right now are really popular, I actually see some people
There's a downside to that.
Yeah, there's a downside. And for some people with thyroid, that's not providing enough carbohydrate, because carbohydrate also is involved in that T4 to T3 conversion, which we didn't really talk about. But you do need some good quality carbs in your diet, especially as women. I find we're more sensitive to very, very low carb diets. So we have to be careful.
So that was a lot of information. Thank you, Sarah, for coming.
You're welcome.
Thank you guys for listening in. If there's any more questions, use the clickable link on this stream. Thank you very much. Have a great day.
Bye.